Hello, my name is Carol Zarakor, and I will be presenting a theoretical view of healthcare. We'll first discuss Gestalt theory. Gestalt theory is a theory of perception and problem solving, and a way of seeing the world. There are several areas of perception that Gestalt looks at. One is visual closure, proximity, continuation, figure ground, and similarity. In the words of Max Wertheimer, the basic thesis of Gestalt theory might be formulated thus: there are contexts in which what is happening in the whole cannot be deduced from the characteristics of the separate pieces, but conversely, what happens to a part of the whole is in clear-cut cases determined by the laws of the inner structure of its whole. I'll demonstrate how occupational therapy uses visual perception assessment and treatment in practice. Notice how all of the utensils are very similar. We might have a stroke patient attempt to place the fork where the fork belongs among all the others. That is an example of similarity. A bed with white sheets, it would be difficult to locate a white towel on the white sheets. So that would be an example of figure ground. And in this case, if the patient had that difficulty, we would provide them or recommend that they use opposite or contrasting colors. When you look at medication, you see you can have difficulty with figure ground, you can have difficulty with similarity as well. Some assessments that occupational therapists use to determine the deficit areas in visual perception are the Berry Visual Motor Integration Test, the Motor Free Visual Perception Test, and the Developmental Test of Visual Perception. And these are only a few. There are multiple assessment tools. And we'll move on to the attribution theory, introduced by Fritz Heider in 1958, further looked at by Bernard Weiner in 1974 and Harold Kelly. Attributions are the process of explaining one's own behavior and the behavior of others. It discusses how people describe events and experiences in their lives and how they adapt to the results of those actions. The theory that people attribute results to something either internal or external and positive or negative. Patient motivation or lack of progress, such as saying, "It must be your fault, not mine." Dr. House is in the hospital. He's grouchy. He says, "I'm still in the hospital because my therapist is incompetent." Ah, gosh. No, he certainly couldn't be because he didn't follow orders and took too many pain meds. That was an example of fundamental attribution error. Falls are the leading cause of fatal and non-fatal injuries in persons over 65. What did the people over 65 attribute their falls to? Hinman says that they feel that an internal intervention such as an exercise program is more beneficial than environmental modifications. In my experience, patients do not like to adjust their environment or change their environment, and they will choose to blame their falls on things such as medication, dizziness, and even just carelessness. And with medications, they blame the medication that the physician gave them isn't working. Or they can say that they reduced their falls because they now use a pill box to organize their medications. Some assessment tools that we use in the for this would be a home evaluation for safety, self-efficacy assessments, interviews, videotaping. Cognitive load theory. One interesting finding was that John Sweller said the use of the PowerPoint presentation has been a disaster. It should be ditched. Why did he say that? Cognitive load theory is about learning and problem solving. You should manage the intrinsic information, reduce the extraneous information, and capitalize on the germane information. Measuring expertise and adapting your instruction accordingly is one intervention tool for based on the cognitive load theory. Reducing the problem space by breaking problems down into parts and by using partially completed problems and work examples. Merging together multiple sources of visual information whenever possible, and extending the capacity of working memory by using both visual and auditory channels. This is a home exercise program, and typically home exercise programs are provided to our patients. Would you be able to follow this home exercise program or this one? Cognitive load theory explains that visual diagrams and simple words are easier to follow than just words. Cognitive load theory has high cognitive load and explains low cognitive load. In high cognitive load, instructions should be given in text so that people can look back on the text and information and understand it. Diagrams also should be provided, and minimal verbal instruction for high cognitive load. For low cognitive load, simple verbal instructions are fine. Providing visuals are also good, but do not include both verbal and written visual instructions, such as repeating words from the PowerPoint. And this is where Sweller got the point, talked about the point of not using the PowerPoint. And I think it was more about how we use it, not the fact that we use it. Elaboration theory is another theory. Elaboration theory wants to see the big picture and then break it down into concepts, procedures, theories, and learning prerequisites. And by learning prerequisites, it goes in a sequence. You can summarize the information to show the big picture, synthesize the information, provide analogies, and this is used for cognitive strategies. And another fact for the elaboration theory is it's supposed to be learner controlled, which means that you go back and forth between the big picture, such as with the procedures, you would look at the big picture, then learn the procedures step by step, go back to the big picture, make sure you're getting it, and you go back and forth. And the same with the theories. Step by step learning, but look at the big picture in and out. And prerequisites and concepts. A key idea of elaboration theory is that the learner needs to develop a meaningful context into which subsequent ideas and skills can be assimilated, such as backward and forward chaining, which is what we use in occupational therapy treatment. And from the words of Stephen Covey, to begin with the end in mind means to start with a clear understanding of your destination. It means to know where you are going so that you better understand where you're now, so that the steps you take are always in the right direction. And that's an example of backward chaining, looking at the end and then backing up and starting from the beginning. An example of that is where the father's teaching the daughter how to tie her shoes. You notice the left shoe is tied. He tied it for her. Now he's helping her tie it one step at a time. backward chaining. Then we have forward chaining. You don't have to see the whole staircase, just take the first step. An example of that is where the dad starts with teaching the son how to dress himself. So the little boy put the shirt on over his head by himself, and now the father is putting his arm in for him, and he will do the rest. And the next time he might put the shirt over his head, put his arm in, then the father helps him with the rest. That's forward chaining. An occupational therapy intervention has dealt with this type of theory since its beginning 100 years ago. For example, in this picture we see it literally is underwater basket weaving, and you notice on the table there's an example of the basket. The therapist has shown the patients the basket, and now she's teaching them step by step. And another example in occupational therapy intervention is how we use activity analysis, and we grade our activities. And this example is where Julian wanted to make a meal for his girlfriend. And then the therapist broke down the steps and the goals and worked up to the point of preparing the meal for his girlfriend. Functional context theory is it is a theory by Steit, and it is learning based on prior knowledge. Society and culture play a large part in learning. The learner has a human cognitive system. Learning is information processing. Learning is developmental, and learning in context is important for transfer. In World War II, the functional context theory was used to teach Navy personnel specific job tasks. It's also been used in adult vocational programs, adult literacy programs, community programs, and we also use it for patient advocacy. An important part of healthcare in the functional context theory would be teaching patients health literacy. Occupational therapy and functional context theory are similar in the fact that they focus on specific occupations. The occupational therapy practitioners believe that cognitive functioning can only be understood and facilitated fully within the context of occupational performance. Occupational therapists assess for specific occupational deficit areas using tests such as the Executive Function Performance Test, the Coleman Evaluation of Living Skills, and an ADL checklist. And in conclusion, this project has demonstrated how occupational therapy is grounded in cognitive learning theory, such as functional context theory, cognitive load theory, elaboration theory, Gestalt theory, and last but not least, attribution theory. Thank you.